Arthropod-Borne virus encephalitis. Arthropod vectors transmit several types of viruses that cause encephalitis. The primary vector is the mosquito. Arbovirus infection occurs in specific geographic areas during the summer and fall. The four types of arboviral encephalitis that occur in North America are Lacrosse encephalitis, LACROSSE, Lacrosse encephalitis, St. Louis encephalitis, Western equine encephalitis, and Eastern equine encephalitis. Pathophysiology. Viral replication occurs at the site of the mosquito bite. If adequate virus is inoculated, a viremia ensues. The virus gains access to the central nervous system (CNS) via the cerebral capillaries. It spreads from neuron to neuron, predominantly affecting the cortical gray matter, the brainstem, and the thalamus. Meningeal exudates compound the clinical presentation by irritating the meninges and increasing ICP. Clinical manifestations. All arboviral encephalitis begins with a flu-like prodrome, but specific neurologic manifestation depend on the viral type. Lacrosse encephalitis, for example, may present with focal neurologic symptoms and seizures. Mortality is low, but residual seizures may occur. A unique clinical feature of St. Louis encephalitis is SIADH, capital letters. SIADH is syndrome of inappropriate antidiuretic hormone with hyponatremia. The mortality rate is 10% to 20%. The clinical manifestations of Eastern equine encephalitis are acute and carry a high mortality rate of 50 to 75%. Although the clinical manifestations of Western equine encephalitis are non-specific, the morbidity rate is high. Assessment and diagnostic findings. Neuroimaging is not useful in diagnosing many types of encephalitis. In Eastern equine encephalitis, however, CT scan and MRI may reveal lesions in the basal ganglia and thalamus. The CSF analysis shows a normal glucose level, elevated protein level, and polymorphonuclear leukocytic pleocytosis. St. Louis Eastern equine and Western equine encephalitis viruses are rarely isolated in the CSF. The age of the patient is important information in making a specific viral diagnosis. Lacrosse virus encephalitis is the most common pediatric arboviral encephalitis. St. Louis encephalitis affects adults over 50 years of age. Eastern equine encephalitis is not age specific. Western equine encephalitis can present as pediatric encephalitis but is less prevalent. Medical management. There is no specific medication for arboviral encephalitis. Medical management is aimed to controlling seizures and increased ICP. In nursing management, if the patient is very ill, hospitalization may be required. The nurse carefully assesses neurologic status and identifies improvement or deterioration in the patient's condition. Injury prevention is key in light of the potential for fall or seizures. Arboviral encephalitis may result in death or lifelong residual health issues. The family will need support and teaching to cope with these outcomes. Public education addressing the prevention of arboviral encephalitis is a key nursing role. Clothing that provide coverage and insect repellents should be used in high-risk areas. Community mosquito control is advocated. Thank you.